Hello, I'm David Kidney. I'm the UKPHR's Chief Executive. I'm making this second webinar about our new portfolio assessment route for specialists in February 2019, so 5 months on from when we began the new route, and I'd like to talk to you about what we've learned and what it means for the new route for you. So I'm going to take you through the following slides. And the first thing to explain is that the reason we undertook this project is we want our portfolio assessment route to get back to following as closely as possible the curriculum for the training programme. Currently, that curriculum is the 2015 curriculum. And in future, for this new portfolio assessment route, anyone wishing to prove their knowledge according to the 2015 curriculum, for our purposes, can either pass the Part A exams in full, and that's it, we'll accept that as the evidence of all the knowledge requirements, or they'll have to show their evidence and we'll assess it in the way we have in the past. And that also applies to the show house, the application and understanding of that knowledge. So it's worth bearing in mind that when we opened the new specialist registration by portfolio assessment route in September 2018, we also announced that we were going to close the existing portfolio assessment routes. That's recognition of specialist status and defined specialist routes. And we said that they would end in August 2019, which means that from the 1st of September this year, 2019, this will be the only portfolio assessment route for specialists. And the other thing I want to stress is that this is not a development route. This is for people who already have the skills and knowledge and by their portfolio of evidence are going to satisfy our assessors that that's the case. So we match the competencies for our new portfolio assessment route to the 2015 curriculum. But it's not an entire match, and there's a very good reason for that. People who are on the training programme will sometimes have the same competences assessed several times during their training programme in different settings. Whereas for this route, which is a retrospective portfolio assessment, it's expected that people already have all of the competencies required, and so they only need to establish them for us once. And so in some places, for example, we have grouped competencies for the purpose of that portfolio assessment. It's also worth mentioning that in the 2015 curriculum, we have the new Key Area 10 covering integration and application of the competencies for consultant practice. And we have sought to integrate that Key Area 10 into our new pre-application stage, about which more in a moment. And at the same time, a lot of Key Area 9, which is the professional, personal and ethical development, is also going to be in our pre-application process instead of in the portfolio. So far as the other 8 key areas are concerned, they will all apply in respect of the assessment of the portfolio. So for this portfolio assessment route, we have designed a 2-stage process. First, a pre-application where you apply to us for, in effect, permission to submit a portfolio of evidence to us for assessment. And then if that is successful, the second stage is the submission of the portfolio for assessment by us. And the reason we've done this is, first of all, that in the past we have found that some people have submitted portfolios to us for assessment when they're clearly, it's clearly not appropriate that they ought to have done so. And we want to be able to help people at a much earlier stage to say, you're not yet ready to make an application by this route. So in the pre-application stage, we will check that somebody is acting at the right level, which is at least that of a level of a newly qualified consultant. And we will also check that they will be able to go on to show in their portfolio their competencies across all of the domains of public health. So specifically in the pre-application, as I've already said, the Key Area 10 competencies and most of Key Area 9 will be addressed at this stage in the pre-application. We'll also be checking that you If you apply, hold a postgraduate qualification in any discipline that's relevant to public health. And we will also check that you are maintaining and enhancing professional knowledge and skills through continuing professional development, CPD, and that we want you to be participating in a relevant formal CPD scheme. And the people who we're expecting to apply are clearly those working in a public health role following good public health practice. They need to be able to show that they are using a range of advanced public health skills and working at senior organisational levels, and that they have experience of strategic leadership and collaborative working for health. And if you are going to apply at the pre-application stage, we want you to also be clear that you will have to submit a portfolio to us within 18 months if we grant the permission for that to happen. There are a number of requirements for the pre-application. These are all set out on our website, and I'm not going to repeat them here. The only one I'll draw some attention to is that we have now structured the reference so that it's a reference that we require in support of the pre-application in a form that we have designated, and that's the one that must be used. We're also looking for the referee to be someone who has direct observation of your work within the past 3 years. So when we receive a pre-application, it's possible that staff in the office might reject an application because it's incomplete and send it back, or they might request further information before they regard it as complete. But when it is complete, it will be passed to a single assessor to consider, and that single assessor may consult with other assessors and with moderators before reaching a conclusion. And in making a conclusion, the assessor delivers a recommendation to our Registration Approvals Committee. And if the decision of the committee is to refuse the application, then reasons will be given for that refusal. The quality assurance that applies at this pre-application stage is that, first of all, our staff check an application on receipt. And then after that, the single assessor works diligently on the application and may work with another assessor or a moderator in coming to a conclusion and making a recommendation. And the decision that's made by the Registration Approvals Committee will be minuted, and as I've said, reasons will be given in the event of a refusal. And the last quality mark of this route is that we're aiming for a turnaround of 6 weeks on giving a decision after an application is received that it is complete and in order. So if the pre-application is approved, then you as an applicant would have 18 months from then to submit a portfolio for assessment. The portfolio will be assessed by 2 assessors in the same way that we've always assessed portfolios until now. Remember that the 2015 curriculum and our requirements will apply to the assessment, and that's something that I'll now deal with. But just first of all to mention that if the pre-application is refused, we will give reasons for the refusal, and therefore there is a right of appeal if wants to contest those reasons. And if an application has been refused, once 6 months have elapsed, you as an applicant may apply again. But do bear in mind that in your career, you have 3 applications maximum that you can make by this route. So when we come to the portfolio, there are 61 knowledge competencies, which compares with 51 that there were for the defined route previously. The level required for this knowledge is master's level, though not necessarily by showing that you have completed a master's course. And as I said right at the beginning, a person who has passed the Part A exams within the past 7 years will need to do no more to satisfy us on all of these 61 competencies. The passing of the exams is sufficient. However, for someone who hasn't passed the exams, we're expecting evidence in support of all 61 competencies, and that evidence will be assessed. We'll also expect in each key area there'll be an overall reflective piece covering the knowledge, and the evidence needed of how the knowledge is acquired is also to be provided. And we want you to note if in a particular competency the word currency is used or current knowledge is used, then it's very important to make sure that the knowledge is current. And what do we mean by that? If the acquisition of knowledge is more than 7 years ago, an applicant must write a reflective piece for each specific competency and show some current knowledge at the date of submission. It is possible to rely on evidence in support of the show hows, the application of the knowledge, to supplement the knowledge evidence as well. For example, if you've written a reflective piece. We also provide a model matrix of evidence for people to set out their evidence against the competences. And it's necessary to use that matrix, but you may also find it helpful to use it. Remember that for key areas 9 and 10, the knowledge has already been assessed in the pre-application application, and it won't be required to be shown again. When we come to the show how competencies, this is evidencing that the knowledge has been applied and that you as an applicant understand the way you've applied the knowledge. There are 40 competencies in total, covering key areas 1 to 9. You can claim each competency once if that's possible, rather than keep duplicating the same claims in different parts of the portfolio. You will, however, need to write a number of summaries, each of them setting out a different piece of work that you have undertaken. And in this, you are demonstrating that you have had a personal and a senior role in a substantial piece of work that's relevant to each word of the competency being claimed. Overall, at least 50% of this work and the evidence relied on to prove it must be less than 5 years old at the time of submitting the portfolio. The evidence needs to be objective, so we expect to see, for example, reports written by you or minutes of meetings that describe a contribution at the meeting by you, or a piece of work that you have carried out or commissioned. And it's very important that all of this evidence clearly indicates your individual input. So however shy or modest you may be, it's very important to use that I word throughout the portfolio. Just some additional help with the show how information. It's really important for the assessor's sake that the portfolio is easy to navigate. And so it's very important that you provide them with clear navigation through the narrative and through the evidence and how you've organised it in the portfolio. And don't forget to use the matrix that we provide. We require you to use it anyway, but you should find it helpful in ordering your portfolio to complete the matrix of your evidence against the competencies. Do bear in mind the strict rules about confidentiality. If we find that you've still left in your portfolio evidence of somebody's personal details, for example, or revealed members of the public's identity, that will be a fail in that item in your portfolio, and you'll have to redo it. It is possible to use testimonials to supplement evidence in support of specific competencies, but in that case you must use a pro forma that we have prescribed for this purpose. The portfolio assessment process is that when we've got your portfolio and we've checked it and it's in order, we'll allocate it to assessors. And we'll expect the assessors to complete a first assessment within 8 weeks. And the entire process from when the assessment begins until you have your very final decision should be no more than 6 months. And this is inclusive of any clarifications or resubmissions that assessors may require. And I'll come on to those in a moment. The assessors agree a joint assessment of a portfolio and report it to a meeting of our registration panel. And there, their peers, so other assessors and moderators, will discuss their recommendations. And when the registration panel has reached a firm conclusion, a decision letter will be sent to you as an applicant to set out the decision. And there is an ongoing role for you in the assessment in that you will receive a decision letter, and in it there will be an offer of a discussion with an assessor within 10 days. And in that, the assessor would be setting out to you the problems that were encountered with the portfolio. They're not going to explain how you should solve the problems. That's for you to determine. They will tell you the what is the problem, but not the how. How should you solve that problem? The maximum time to deliver clarifications required by assessors is 6 months, and in a change, the maximum time now to deliver resubmissions will be 6 months the same. So in both cases, it's 6 months in the future. So just to explain clarifications, this may be where the assessors can find evidence in support of a competence claims, but they don't believe that it's adequate. It might be that with more detail it would be adequate, so they might want to see the content of a course in which knowledge has been claimed or a role has been carried out. They might want to see more evidence of a project to show that your personal involvement was as you claim that it is. And the evidence can be by a written statement and supplementary documentary evidence. If the clarification is inadequate, then the assessors might move on and say, well, we don't think this is going to be satisfactory in the future, and so therefore we want you to resubmit new evidence from a new area of work to establish this competency. And so let's come on to resubmissions. This is where the assessors feel that the evidence is inadequate to demonstrate competence, and they don't believe that even by providing more evidence it's ever going to be adequate. And so instead they require you to produce new evidence from a different piece of work. The reasons for this are explained in the decision letter that is sent to you, and as I've said before, a discussion with an assessor will be offered so that the assessor can explain what is the problem, but of course not how to solve the problem. So as I say, the time limit for compliance with both clarifications and resubmissions has been aligned at 6 months. And wherever possible, when the clarifications come in or the resubmissions come in, the same assessors who assess the portfolio will assess the new evidence. And if you have trouble meeting a deadline for completing a clarification or a resubmission, it's possible to ask UKPHR for an extension of time, and the registrar can, for good reason, extend the time for compliance for up to 2 times. And as far as the quality assurance is concerned at the assessment of a portfolio stage, well, moderators are available throughout the process to advise and respond to queries and help assessors or moderate an assessment if there's a particular problem or challenge with a portfolio. Clarifications and resubmissions will be available to assessors and decision letters explaining why, and the registration panel will debate assessors' recommendations, and eventually the registration panel will make a recommendation to the Registration Approvals Committee to admit to the register if the portfolio has been satisfactorily completed and assessed as satisfactory, and the person will be admitted to the register. And do bear in mind that our registration panel and our Registration Approvals Committee keep minutes of all of their meetings. So it's possible to fail an assessment, and there are 3 ways in which it's failed. The first one is that the assessors still haven't approved the portfolio after 3 attempts, and that will be the end of the assessment and the portfolio will be returned. In addition to that, there is a process of a complete return, which would be at the pre-application stage, the determination has been made that you as an applicant are not working at the right level, or when the assessors get to look at a portfolio, they come to the conclusion that the person is not working at the right level. That would be a decision that would be discussed by a registration panel before a complete return is agreed. In the event of a complete return, there are 2 opportunities to resubmit a portfolio afterwards. And then the third way to fail an assessment is an unassessable, and this is entirely down to putting together an adequate portfolio. If there's poor navigation, for example, assessors will report to the panel that it's just too difficult to assess the portfolio, and it will indeed be sent back. And it's possible to resubmit that portfolio once tidied up and the problems addressed, within 6 months. The quality assurance at the failing and assessment stage is that moderators will be involved in all the 3 scenarios I've described. The registration panel in most cases will debate the assessor's recommendations, and in any event a registration approvals committee will be involved if there's a refusal of any sort, and a decision to refuse will carry a right of appeal. In terms of support for guidance, we provide written guidance on our website. We believe that it's comprehensive, and we believe that it's adequate for most purposes. And of course, a person who's read the guidance and has individual queries about their circumstances can contact the office, and we're always happy to give additional assistance in that way. We do know that in some parts of the country at some times there has been support for specialists who are looking to submit portfolios to UKPHR for assessment. They're not connected with ourselves, but we think it's a very welcome development that such support is given. Ideally, we'd like to think going forward that the public health system as a whole will arrange developmental support for specialists. So they are considering an application to us by portfolio assessment under this route, that they will have the support that they need. So the last thing I would want to stress is that you have our contact details. We want to be of assistance, and if a person has queries, we're always very welcome to try to assist more. So please feel welcome to contact us if you need to. Do always look at our website to see if there is guidance and frequently answered questions, for example, that can already answer the query that you have. But otherwise, you're very welcome to contact us. We want to help.